The patient refused to let the foreign doctor touch him, even though he was dying. But Dr. Kim had taken an oath to save lives, and he was about to show this racist patient what true American values really looked like. The emergency room at St. Mary's Hospital in Birmingham, Alabama was unusually quiet for a Friday night when the ambulance sirens shattered the calm. Dr. Sarah Kim, the hospital's chief cardiac surgeon, was reviewing patient files when the paramedics burst through the doors with a man in cardiac arrest. "We've got a 55-year-old male, massive heart attack, been down for 12 minutes, shouted EMT Rodriguez as they wheeled the patient toward the trauma bay. "BP is dropping fast. Pulse is weak and thready." Dr. Kim immediately sprang into action, her years of medical training taking over. As the chief cardiac surgeon, she was the best hope this patient had for survival. At 38 years old, she had performed over 2,000 heart surgeries and had one of the lowest mortality rates in the Southeast. "Get him 2 or 3, call the cardiac team, and prep for emergency bypass," Dr. Kim ordered as she examined the patient. "This is going to be close." As the medical team worked to stabilize the patient, he briefly regained consciousness. His eyes fluttered open, and when he saw Dr. Kim leaning over him, his face contorted with hatred despite his critical condition. Get that gook away from me," he gasped between labored breaths. "I don't want no foreign doctor touching me." The emergency room fell silent. Dr. Kim had faced racism before in her career, but never from a patient whose life hung in the balance. The other medical staff looked uncomfortable, unsure how to respond. "Sir, I'm Dr. Kim, and I'm going to save your life," she said calmly, continuing her examination. "You're having a massive heart attack. Without immediate surgery, you'll die within the hour." "I said no," the patient wheezed. "Get me a real American doctor. Not some communist who probably learned medicine in a rice paddy." Dr. Sarah Kim had been born in Seoul, South Korea, but had immigrated to the United States with her parents when she was 5 years old. Her father was an engineer, her mother a nurse. They had sacrificed everything to give their daughter the opportunity to achieve the American dream. Sarah had excelled in school, graduated valedictorian from Stanford Medical School, and completed her residency at Johns Hopkins. She had chosen to practice in Birmingham specifically because she wanted to serve a community that had fewer Korean doctors, believing she could make a real difference. "Sir, I understand you're scared," Dr. Kim said, her voice remaining professional despite the patient's continued racial slurs. "But I need you to know that I'm the best cardiac surgeon in this hospital. I've performed this exact surgery hundreds of times. I'd rather die than have some slope-eyed foreign." "That's enough," interrupted Nurse Johnson, a veteran African-American nurse who had worked at St. Mary's for 20 years. "Dr. Kim is trying to save your life." The patient's monitor began beeping more urgently. His blood pressure was dropping, and his heart rhythm was becoming increasingly erratic. Dr. Kim knew they had minutes, not hours. "Sir, you're going into cardiogenic shock," she explained urgently. "Your heart is failing. If we don't operate immediately, you will die. I'm the only cardiac surgeon in the hospital tonight." The patient's face was turning blue as his oxygen levels plummeted. Despite his racism, despite his hatred, Dr. Kim felt the familiar surge of adrenaline that came with knowing she was the only thing standing between a patient and death. I want another doctor," he whispered weakly. "Doctor." Kim looked at the monitors, then at her patient. She had trained for moments like this, though she had never imagined the patient would be someone who despised her very existence. "Sir, there is no other doctor. It's me or death. Those are your options." The patient's eyes began to close as he lost consciousness again. Dr. Kim turned to her team. "We're going to surgery. Now." "But Dr. Kim," said Dr. Martinez, the resident, "he refused consent. He specifically said he didn't want you to operate." Dr. Kim paused for a moment, wrestling with the ethical dilemma. She could legally wait for the patient to be transferred to another hospital, but that would take hours he didn't have. She could let another doctor attempt the surgery, but none of them had her experience with this type of complex cardiac emergency. "He's unconscious and in immediate danger of death," she finally said. "I'm invoking emergency medical protocols. We have implied consent to save his life." As they rushed toward the operating room, Nurse Johnson whispered to Dr. Kim, "Are you sure about this?" After what he said. Dr. Kim looked at the patient, now completely unconscious and dependent on machines to keep him alive. "I took an oath to do no harm and to save lives. That oath doesn't have exceptions for people who hate me." The surgery was one of the most challenging of Dr. Kim's career. The patient had suffered massive damage to his heart, with multiple arteries blocked and significant tissue death. For 6 hours, she worked with microscopic precision, performing a quadruple bypass and repairing damaged valves. "How's it looking, Dr. Kim?" asked Dr. Martinez as they worked through the night. "Touch and go," she replied, sweat beading on her forehead despite the cool temperature of the ore. "He's got good insurance, but his heart doesn't care about that right now." At 3:47 a.m., Dr. Kim stepped back from the operating table. "That's it. We've done everything we can. Time will tell if it's enough." The patient was moved to the cardiac ICU, where he remained unconscious for 3 days. Dr. Kim checked on him regularly, monitoring his progress and adjusting his medications. The surgery had been successful, but his recovery would be long and uncertain. On the 4th day, the patient finally woke up. His first words were asking for water. His second words were asking what had happened. His third words were asking about his surgeon. "The cardiac surgeon who operated on you was Dr. Sarah Kim," explained Nurse Johnson. "She's the one who saved your life." The patient's face immediately clouded with anger. "You mean that Korean woman operated on me? After I specifically said no." "You were unconscious and dying," Nurse Johnson replied firmly. "She had no choice but to save your life. I could sue her for operating without my consent." "Sir," Nurse Johnson said, her voice taking on a tone that had intimidated generations of medical students, "let me explain something to you. You came in here dead. Your heart had stopped. Dr. Kim brought you back to life and gave you a new heart, literally. She could have let you die, and no one would have blamed her. But she saved you because that's what doctors do." The patient remained angry, but as the days passed and his strength returned, he began to understand the magnitude of what had happened. Dr. Kim continued to check on him during her rounds. Always professional. Always focused on his medical needs. "How are you feeling today, Mr. Wilson?" she asked during one visit. "I'm alive," he replied curtly. "Though I still don't understand why you operated on me after what I said." Dr. Kim sat down in the chair beside his bed. "Mr. Wilson, can I tell you something about my family?" He didn't respond. But he didn't tell her to leave either. "My parents came to America when I was 5 years old," she began. "My father worked 3 jobs to put himself through engineering school. My mother cleaned offices at night while studying to become a nurse. They sacrificed everything so I could have opportunities they never had." Mr. Wilson listened silently. "I became a doctor because I wanted to help people. All people. When I see a patient, I don't see their race or their politics or their personal beliefs. I see someone who needs help." "But I was awful to you," Mr. Wilson said quietly. "I said terrible things." "Yes, you did," Dr. Kim agreed. "But you were also scared and in pain. Fear makes people say things they don't always mean." Mr. Wilson was quiet for a long moment. Did you really save my life?" "Your heart had stopped, Mr. Wilson. Without surgery, you would have died. The surgery was complex. We had to bypass 4 arteries and repair 2 valves. You'll need to take medications for the rest of your life and make significant lifestyle changes. But you should be able to live a normal life." "How long did the surgery take?" 6 hours. Mr. Wilson stared at the ceiling. You stood over me for 6 hours. Operating on someone who had called you racial slurs and told you he'd rather die than have you touch him. I stood over you for 6 hours because you're a human being who deserved to live, Dr. Kim replied. That's what I swore to do when I became a doctor. Over the next week, Mr. Wilson's attitude began to change. He started asking Dr. Kim about her background, her training, her family. He learned that she had graduated at the top of her medical school class, that she had been recruited by hospitals across the country, and that she had chosen to practice in Birmingham because she wanted to serve a community that needed her skills. Dr. Kim, he said during one of her visits, I need to ask you something, and I want you to be honest with me. Of course. Are you a better surgeon because you're Korean, or despite being Korean? Dr. Kim smiled. Mr. Wilson, I'm a good surgeon because I studied hard, trained under excellent teachers, and I care about my patients. My heritage has nothing to do with my surgical skills, except that my parents' emphasis on education and hard work probably helped me succeed. I've been thinking about what you said, Mr. Wilson continued, about fear making people say things they don't mean. I think I've been afraid my whole life. Afraid of what? Afraid of changes. Afraid of people who were different from me. Afraid that somehow their success meant my failure. Dr. Kim nodded. Fear is a powerful emotion. But so is courage. And choosing to change, to grow, to see people differently, that takes courage. On the day Mr. Wilson was discharged, he asked to speak with Dr. Kim one more time. Doctor, I want to apologize. Not just for what I said in the emergency room, but for my whole attitude. You saved my life, and I repaid you with hatred and racism. Mr. Wilson, you don't need to. Yes, I do, he interrupted. I need to say this. You showed me what it means to be a real American. Not someone who hates people who are different, but someone who helps others regardless of who they are. Dr. Kim was touched by his words. Thank you, Mr. Wilson. That means a lot. I want to ask you something, he continued. Would you mind if I brought my family to meet you? My kids, my grandkids. I want them to meet the woman who saved my life. And I want them to hear me apologize to you. Dr. Kim smiled. I'd be honored to meet your family. 2 weeks later, Mr. Wilson returned to the hospital with his wife, 2 adult children, and 3 grandchildren. He had asked Dr. Kim to meet them in the hospital's family conference room. Everyone, Mr. Wilson began, this is Dr. Sarah Kim. She's the woman who saved my life. His family looked at him with confusion. They had expected to meet the doctor who had operated on him, but they hadn't expected this introduction. When I was brought to this hospital, Mr. Wilson continued, I was dying. Dr. Kim was the only surgeon who could save me. But when I saw her, I said terrible things. I called her names. I told her I'd rather die than have her operate on me. His wife gasped. Bob, you didn't. I did. I was a racist, and I'm ashamed of it. But Dr. Kim saved my life anyway. She operated on me for 6 hours, even though I had been cruel to her. She showed me what real American values look like. He turned to Dr. Kim. I want my family to know that you're not just a great surgeon. You're a great American. You're the kind of person I want my grandchildren to look up to. Dr. Kim was moved to tears. Mr. Wilson, thank you. This means more to me than you know. His youngest granddaughter, a 7-year-old girl, walked up to Dr. Kim. Are you really a heart doctor? I am, Dr. Kim replied, kneeling down to the girl's level. My grandpa says you fixed his heart and made it better. I helped fix the part of his heart that pumps blood. But I think your grandfather fixed the other part of his heart himself. The little girl looked confused. Hearts have 2 parts. Dr. Kim smiled. Hearts have the part that pumps blood, and the part that feels love. Your grandfather's heart was sick in both ways, but now both parts are healthy. 6 months later, Mr. Wilson attended a fundraising dinner for the hospital's new cardiac wing. He had become one of the hospital's most vocal supporters and had raised over $50,000 for the new facility. When Dr. Kim was recognized for her contributions to the hospital, Mr. Wilson stood up and began applauding. Soon, the entire room was on their feet, giving her a standing ovation. After the dinner, Mr. Wilson approached Dr. Kim. "Doctor, I want you to know that you didn't just save my life. You changed my life. I'm not the same person I was 6 months ago." "How so?" Dr. Kim asked. "I volunteer at the Immigration Center now, helping new Americans navigate the healthcare system. I want to help people the way you helped me." Dr. Kim smiled. "That's wonderful, Mr. Wilson. I'm proud of you." "I have one more favor to ask," he said. "My church is having a community dinner next month. Would you be willing to speak to our congregation about service and compassion?" "I'd be honored." At the church dinner, Dr. Kim spoke to a packed room about her journey from Korea to America, her challenges as an immigrant, and her commitment to healing others. But the most powerful moment came when Mr. Wilson stood up to introduce her. "6 months ago, I was a different man," he told the congregation. "I was filled with hatred and fear. I believed that people who looked different from me were somehow less American than I was. Then I met Dr. Kim under the worst possible circumstances, and she showed me what true American values really look like." He paused, looking at Dr. Kim with gratitude. "She saved my life, even though I had been cruel to her. She showed me that being American isn't about where you were born or what you look like. It's about your character, your values, and your commitment to helping others." The congregation erupted in applause. Dr. Kim was deeply moved by the transformation she had witnessed in Mr. Wilson. After the dinner, an elderly woman approached Dr. Kim. "Doctor, I'm Mr. Wilson's mother. I'm 87 years old, and I've lived in this community my whole life. I want to thank you for saving my son's life. But more than that, I want to thank you for saving his soul." Dr. Kim felt tears in her eyes. "Mrs. Wilson, your son is a good man. He just needed to remember who he really was. He tells everyone about you," she continued. "He says you're the best doctor in Alabama, and more importantly, you're the best example of what an American should be." As Dr. Kim drove home that night, she reflected on the events of the past 6 months. She had saved many lives during her career, but she had never experienced anything quite like this. She had not only saved a patient's life but had also helped heal the divisions that can tear communities apart. She thought about her parents, who had sacrificed so much to give her the opportunities she had enjoyed. She thought about her medical school oath to do no harm, and to serve all patients regardless of their background. She thought about the power of compassion to transform even the most hardened hearts. The next morning, Dr. Kim received a letter from Mr. Wilson. Inside was a photograph of him volunteering at the Immigration Center, helping a young Korean family navigate the healthcare system. The letter read, "Dear Dr. Kim, I wanted you to see this photo. This is me helping a family that recently arrived from Korea. Their son needs heart surgery, and they were scared and confused about the American healthcare system. I thought about what you went through when your parents brought you to America, and I wanted to help them the way you helped me. Thank you for teaching me that healing isn't just about medicine, it's about the heart. Your grateful patient and friend, Bob Wilson." Dr. Kim kept that letter on her desk as a reminder of why she had chosen to become a doctor. It wasn't just about the technical skills or the prestige. It was about the opportunity to heal not just bodies, but hearts and souls as well. Years later, when Dr. Kim was asked about the most meaningful case of her career, she would always talk about Mr. Wilson. Not because it was the most complex surgery or the most challenging medical case, but because it reminded her of the power of compassion to transform lives. "Medicine isn't just about treating disease," she would tell her medical students. It's about treating people with dignity and respect, regardless of how they treat you. Sometimes the greatest healing happens not in the operating room, but in the human heart. Mr. Wilson lived for many more years, becoming a beloved figure in his community and a tireless advocate for immigrant rights. He would often say that Dr. Kim had given him two gifts: a second chance at life, and a second chance at being the person he was meant to be. The story of Dr. Sarah Kim and Mr. Wilson became a legend at St. Mary's Hospital. Told to new medical students as an example of the power of the Hippocratic Oath and the importance of treating all patients with compassion and respect, T was a reminder that sometimes the most profound healings occur not when we fix what's broken in the body, but when we help heal what's broken in the human spirit.